I just wanted to continue where we left off in part one, talking about the longevity pyramid. Basically, the longevity pyramid is just a framework through which you can think about how to live longer and live healthier. We talked about some nutrition tips, some exercise, sleep, and which diagnostic tests to get, and the importance of circadian rhythm, daylight cycle. I just wanted to sort of add to that and say, it's very important to think about ways to lower stress, because stress can certainly shorten your life, and it can lead to chronic diseases like cardiovascular disease, type 2 diabetes, poor sleep, even some forms of cancer. So whether that's, meditation or other relaxation techniques like deep breathing exercises, breath work, there are many different ways to reduce stress, but it's important to at least be thinking about it, and connected to that is really improving your social connections. It's a new year. You may want to try to strengthen some social connections that you have. Maybe you want to eliminate some negative social relationships from your life. So think about that, and also think about what's your purpose. It's a new year. What new goals do you have? What's your overall larger purpose in life? Certainly there's friends, there's family, there's work. Maybe you want to do some volunteer work. Is there anything bigger that you could be doing that will, sort of help guide you through life? And, those who have purpose and those who volunteer more live longer. And that's been proven in numerous studies. As far as what other, habits can you implement into your daily life? The concept of hormesis, which is what doesn't kill you makes you stronger. So there's things to think about like hot saunas, cold plunge, red light therapy. With regard to hot sauna, which probably has the most literature and the most studies on it, you want to try to get into a hot sauna maybe 4 to 5 times a week, even up to 7 times a week for about 15 to 20 minutes per session. 20 minutes is better at a certain temperature, about 160, 180 degrees Fahrenheit. Cold plunge, which gets a lot of attention now. There's less science behind it, but it's certainly looking quite promising. You want to get about 11 or 13 minutes of cold immersion. Usually that's in cold water. It can be in cold air, like cryotherapy, but we're really talking about cold water here. 11 to 13 minutes a week. So that could look like 2 or 3 minutes sessions, or 2 or 3 minute session if you can tolerate it that long, maybe doing that 3 times or 4 times a week. That's going to help you decrease inflammation, and it's going to help make your body more resilient. Same thing with the sauna. The hot saunas, the purpose of those reduces cardiovascular disease, decreases risk of dementia, and those who sauna regularly reduce their risk of all-cause mortality. That means death from any cause is less if you're doing sauna regularly. Another thing you can think about is red light therapy. You can buy one for your home, or you can go to a gym or a wellness facility where you stand in front of a red light machine for 15 or 20 minutes. It decreases inflammation, it increases collagen production in your skin, helps muscle recovery. Some studies say it helps muscle growth, and helps decrease pain if you have any areas that are injured or need extra attention when you're recovering. One other topic of hormesis, again, is intermittent fasting. And we've touched on this before in the nutrition section, but if you could try to not eat for, let's say, maybe 14, 16, 18 hours a day, that means you're only going to eat in a shorter window. Maybe you're going to only eat from noon to 6, or you're only eat from 10 a.m. to 4 p.m. If you have a shorter eating window, your body then has more time to digest food. You have 18 hours of not eating. That's the fasting part. And that's going to really go a long way to help improve your blood sugar and decrease your stored body fat and help promote a better body composition. Another thing to think about is any supplements that you might want to be taking in the new year. I think a good foundation of supplements that like most people should be taking is creatine, which is about 5 grams a day. It's good for muscle health. It's good for brain health. I also think omega-3 fatty acids, like a fish oil or a fish oil supplement, it's great to take also for heart health, muscle health, and for brain health. And you want to get about 1 to 2 grams of EPA and DHA, which are specific types of omega-3 fatty acids, per day. Now, if you happen to eat a diet that contains a lot of high fatty fish, then you might not need to supplement. But most people don't eat enough fish, so they will need to supplement with omega-3s. Also magnesium, most people are deficient in that. That's a great supplement to take. Vitamin D as well. Usually that's combined with K2, so vitamin D3, K2. You can find those combined in one capsule, and a multivitamin. I think, most people, their diets are lacking, and the quality of nutrients that we're eating these days isn't as optimal as it was in the past, just because the quality of the soil is much less. So if you could take a multivitamin, creatine, magnesium, omega-3, vitamin D, I think that's a great foundation of supplements. And if you want to add to that throughout the year, maybe you add one every couple months and see how your body reacts before you add another supplement. Sometimes patients make mistakes and they'll just take like 10 or 15 supplements at once, and you're not quite sure what is giving you the benefit. But I would start with that good foundation of supplements and sort of build from there. That's all I wanted to cover today, and I hope that gives you a little bit more insight to what you can do to help improve the quality of your life, improve your longevity, and just help with overall wellness. And again, think of this as a pyramid, where the base of the pyramid is nutrition, exercise, sleep, and you're building upon that. You're getting the right diagnostic tests at the right time. You're starting to think about decreasing stress and adding purpose to your life and improving your social connections. And then supplements at the closer to the top part of the pyramid, and maybe prescription drugs if needed at the very top of the pyramid. And if you have any questions about that or need any guidance, we have a course that goes through this in great detail. It's about a 7-hour course, and that can be found at wellnessandlongevity.health. It's a digital course. It's a self-paced course that goes into much greater detail on all these topics. So I hope that's helpful. If you have any questions, just leave us a comment or give us a call. Thanks.